Thank you, Chairperson Moses Anderson and members of the committee. My name is Jason Freilinger. I'm from Silverton, Oregon. I'm a small business owner. I own a electronics and game hobby store, formerly a Radio Shack franchise. So as a small business owner, my wife and I started our business 4 years ago. I had spent 15 years in the corporate world in the telecommunications industry. And I wanted to move on to be my own boss. I knew that medical insurance was going to be an important factor, and I did a lot of research in looking at costs associated with opening a small business and providing insurance for myself and my employees. I, of course, quickly learned that it cost me to pay twice as much for an employee as it cost my former employee, or close to twice as much. Because of that risk pool concept. So I was looking at a much higher expense. Actually, a third of my payroll expenses when I first started 4 years ago went to medical expenses. I was excited about the Affordable Care Act coming. I researched the best way to handle that. And I actually found that the best way to handle that was to not provide my employees with insurance. And I provided a $500 stipend for medical insurance, which they then used to go onto the exchange themselves and buy it themselves. Now, that lowered my cost to 20% of my payroll costs. And quite frankly, it saved me from going out of business and being able to do as well as I am now. So the ACA helped, but we can do better. As a small business employer, I want to provide health care for my employees and their families. Actually, I'm very happy to pay for it, as long as it's fair. But I'm also not a medical professional. I shouldn't be making medical decisions about what type of coverage people need or how best to finance it. And honestly, you put employers in that position under our current system. One of the things was just mentioned about tax rates, and I just want to mention that I already said I pay 20% for health care for my employees. I would be very happy to pay 20% to a government-run organization to take care of this so I didn't have to. Employees want medical insurance, and they want medical insurance that stays with them. They don't want to have to worry about changing doctors as they go from job to job. And I know I have limited time, but I'm going to plug in my story just a little bit here. In 2008, I had a stroke of an unusual sort caused specifically by stress. And the doctors essentially said that, I'm not a doctor, but essentially I blew my top due to stress and anxiety related to my job. And I blew out an artery in the back of my neck. For 3 years, I worked through recovery and continued to work on the job that had made me sick because I couldn't get insurance anymore. I couldn't get insurance anywhere. And I couldn't afford to go and get insurance. But I worked through that. And luckily, with the help of my wife, we opened a business and we have found our way. Health care for all is very important to small business because we are at a disadvantage. There is a burden on us to take on things. Just so you know, I have 2 employees and some seasonal part-time employees. I'm not a big employer. My competition have taken their full-time employees and reduced their hours to part-time in order to avoid health care costs through the ACA. Basically giving them a competitive advantage against me, wanting to do the right thing by providing insurance for my employees. I think if we go through with this healthcare for all plan, I know it's not fully made up, but go along with the concept, we will attract smart, skilled employees to Oregon because they'll know this is a good place to live. We will also attract businesses that care about their employees because they know that their employees will be taken care of in a state of Oregon healthcare system. I also believe it will bring positive investment to Oregon as far as growth and economic opportunity. And so for this reason, I ask you to work with us on helping to develop SB 631.